Hi, my name is Hope Straley, and I'm here to tell you what it is like to be a physical therapist and what to do to be a physical therapist. I thrive on helping others, and what helped me make the decision of being a physical therapist is doing sports in high school and being very athletic and making sure my body is healthy and doing the right thing. Taking my body amazes me, especially in the way our limbs move and work. I took anatomy in high school, and it helped me a lot make this decision because I learned about bones and muscles and how we use them. People around me, they're always getting knee surgeries or hurting, and I've always wanted to have that urge to help them out. To be a physical therapist, there are a lot of qualities a person must have. First, you must have an education. To have an education, you can go to Regis University, or you could go to CU Denver, our local places where you can go and get learning. You have to have a postgraduate professional degree is required, and a doctorate degree is also required. They last about 3 years after your regular schooling is done, so you're looking at 6 to 7 years of schooling. The bachelor's degree, the prerequisites you have to take are anatomy, physiology, biology, and chemistry. Second thing which is required is you have to have a license. You have to take a national physical therapy exam to get your license. And to keep that license, you have to keep going to classes and just doing extra work to keep your license. And you don't have to take the test more than once, but that is a picture of the license you would get to be a physical therapist. Part of that. Lots of states require education. All states in the United States require education and all license. The third important quality is compassion. You have to have compassion, you have to have dexterity, which means to move around and you don't mind touching patients. Another thing you have to have is physical stamina. That physical therapy is a job where you move around a lot, and if you're immobile, probably isn't a good thing to be a physical therapist because you have to take care of those who are immobile. You have to be very detail oriented. So when someone comes in, like if you work at a gym and someone's like, my ankle hurts, I don't know what it is, you're going to have to know what stretches to do and just to look at what movements they do. You have to fulfill many duties. This at times can be difficult. I interviewed a physical therapist at the YMCA near my house. She says there are various challenges ranging from insurance issues, which dedicate how many visits certain persons are allowed to TP, to some people lack motivation. Sometimes this number of insurance visits does not take into consideration each person as an individual is not adequate amount for the specific person. Other times, people seem to be brought to a PT against their own desire, but of another family member, so they may not be as motivated to work and get better, as those family members is for them. They provide cares for all ages, from young people, as you can see, you can see right there, there's a little girl. She probably was born with a disorder, not a disorder, but a growth deficiency or something, and so they probably did surgery so that she can move and do walking. And they also bring to older people, like those who are older, have knee surgeries. Like Miss Gabriel, she had knee surgery. She had to go through a lot of physical therapy to get to where she is today. Physical therapists who work in hospitals. They take care of those who have stroke, arthritis, brain injuries, multiple it's the spine disorder, I can't even say. Heart attacks and strokes. Ms. McNutt, the physical therapist I interviewed, she says, we typically see a patient 2 to 3 times a week and decrease their frequency of visits as they progressing, or if they have specific post-operative protocol that calls for them to see a certain amount of times. The only time we see the same patient daily is if we have a joint displacement and need a range of push on it daily. Physical therapists go through 5 certain steps each time they see a patient. First step is watch the patient's movements, flexibility, and coordination, strength, and balance. Step 2, set up a plan with the patient's goals and treatments. Step 3, use exercises, stretching, and equipment to help reduce pain and increase mobility. Step 4, look for progress, update treatments, and by adding new treatment or keeping the same. Step 5, inform patients and their families of what the possible outcomes might be. Now the benefits. This is why you should be a physical therapist. Physical therapist is in the top category of the 25 top jobs, ranking number 8. The satisfaction of helping someone is the benefit of the job. A perk for physical therapists is meeting different types of people, like working at a local gym. There are professional athletes that will come in and they will need help, and so that's cool. You'll see a professional athlete. Not only is physical therapy worth it in emotional satisfaction, but it is good in money. As you can see, Colorado is one of the lowest areas that have high pay for physical therapists. It ranges from $35,000 to $71,000 a year, which is really good because like a teacher's salary ranges from like $40,000 to $50,000. The average salary in Arvada is approximately $65,492. The U.S. salary is approximately $77,637. There are 1,909 physical therapy jobs in 2010, and that ranking is going to get higher because as the baby boomers get older, the need for physical therapists is going to get bigger. So where to go? You can go to your local gym if you are interested in being a physical therapist. If not, it's cool to be in that kind of environment just in case you have an injury. You'll know what to do and what stretches. You can volunteer at a hospital like St. Anthony's on the 7th floor. You can be a little intern with one of the nurses. If you have any questions, email me at hstraley@msudenver.com.